friends, today I am going to talk about arthritis. What is arthritis? Arthritis is a condition that causes damage in your joints. Joints are places in your body where two bones meet. Some types of arthritis happens after injuries that damage a joint. Arthritis can affect any joint but is most common in people, hands and wrists, knees, hips, feet and ankles, shoulders, lower back. Some people with severe arthritis eventually need surgery to replace their affected joints. Types of arthritis. There are more than 100 different types of arthritis. Some of the most common types include osteoarthritis, wear and tear arthritis, rheumatoid arthritis. Arthritis happens when your immune system mistakenly damages your joints. Gout. Arthritis that causes sharp uric acid crystals to form in your joints. Ankylosing spondylitis. Arthritis that affects joints near your lower back. Psoriatic arthritis. Arthritis that affects people who have psoriasis. Juvenile arthritis. Arthritis in kids and teens younger than 16. Depending on which type of arthritis you have, it can break down the natural tissue in your joint or cause inflammation. Some types cause inflammation that leads to degeneration. How common is arthritis? Arthritis is extremely common. Experts estimate that around half of the adults will develop osteoarthritis at some point. Symptoms and causes. The most common symptoms of arthritis and signs include joint pain, stiffness or reduced range of motion, swelling, skin discoloration, tenderness or sensitivity to touch around the joint, a feeling of heat or warmth near your joints. Where you experience symptoms depends on which type of arthritis you have and which of your joints it affects. Some types of arthritis cause symptoms in waves that come and go called flares or flare-ups. Others makes your joint feel painful or stiff all the time or after being physically active. Main cause of arthritis. Osteoarthritis happens naturally as you age. A lifetime of using your joints can eventually wear down their cartilage cushioning. You may develop gout if you have too much uric acid in your blood. Your immune system can cause arthritis when it damages your joints by mistakes. Certain viral infections can trigger viral arthritis. Sometimes arthritis happens with no reason, causes or triggers. Providers call this as idiopathic arthritis. Risk factors. Tobacco use. Smoking and using other tobacco products causes your risk. Family history. People whose biological family members have arthritis are more likely to develop it. Activity level. You might be more likely to have arthritis if you aren't physically active regularly. Other health conditions. Having autoimmune disease, obesity, or other conditions that affect your joints increases the chance you will develop arthritis. Some people have a higher arthritis risk, including people older than 50, females, athletes, especially those who play contact sports, people who have physically demanding jobs or do work that puts a lot of stress in their joints. Diagnosis and test. A healthcare provider will diagnose arthritis with a physical exam. They examine your affected joints and ask about your symptoms. They tell your provider when you first notice symptoms like pain and stiffness and if any activities or times of day make them worse. Your provider will probably check your range of motion. They may compare one joint's range of motion to others similar joints. Arthritis test. Your provider might use imaging tests to take pictures of your joints, including X-rays, ultrasound, magnetic resonance imaging, that is MRI, a computed tomography CT scan. These tests can help your provider see damage inside your joints. They can also help your provider rule out other injuries or issues that might cause similar symptoms like bone fractures. Your provider may use blood tests to check your uric acid levels if you have gout. Blood tests can also show signs of infections or autoimmune diseases. If you want more information, friends, please like, share and subscribe to my channel. Thank you.